Poor working conditions and poor pay have led to hospitals struggling to retain their nurses. As a result, hospitals are now paying private agency nurses double the salary to help, and nursing unions say it's going to bankrupt the system. Ontario's nurses union says hospitals are desperate for help.
There's no staff. They quit, they've retired, they've traveled, they're out. That is the true issue.
Being short-staffed has led to poor and even dangerous working conditions, and while that's one big reason for the shortage, money, or lack thereof, is the real problem. Cathryn Hoy from the ONA says many nurses are signing up for bigger wages with private companies that supply medical staff to healthcare facilities. They're normally reserved for long-term care homes, but the pandemic has forced many hospitals to reach out for help, and they're paying the price.
Nurses making pretty much double what all the other nurses on the floor are making, and the business that they work for is billing the hospital about 4 times what a nurse would be. So they're actually paying 4 times the hourly rate for a nurse that the hospital is paying, which is abuse of healthcare funds.
Hoy says the agency nurses are making anywhere between $80 and $112 an hour. Hamilton Health Sciences tells CHCH that on average, anywhere between 1 to 2 agency nurses are employed over a 24-hour period. However, the situation is worse in other regions. Hoy says she's heard that one hospital's nursing staff is 85% privately employed, something she says is an unsustainable model.
It is going to break the system. It is, because hospitals are going to come back and say, basically, you bankrupt the hospitals. Now, government, we need you to bail us out. You know, kind of like the General Motors deal when the government had to step in and bail them out and keep them going. Are we going down that road?
Hoy says Bill 124 caps the wage increase for public sector workers like nurses at 1% a year. She says removing it would allow hospitals to pay their nurses something closer to agency salaries.
So why not? We're spending the money. The government's going to spend the money on these agency nurses. Why not pay the staff you have that are at the front line? Agency nurses will come back and work in their home communities and get paid what they rightfully should be paid. Then they'll have a pension, then they'll have their benefits, and we'll have guaranteed staffing.
Cathryn Hoy, who you just heard from, acknowledges that Bill 124 is set to expire, but she adds that repealing it now would allow unions to renegotiate previous contracts.